Should I go for follicular unit extraction or weaving? Well, I'm 20 years old and I'm losing hair since I was 17. Now my baldness is clearly visible as I have a pure bald patch on the left and on the right side. I was hoping for an answer so that I can gain my hair back and is safe too.
Thank you for your question. You're 20 years old, and you stated in your question with the photos you submitted that you've been losing hair since you're 17, and now you are clearly noticing significant hair loss, and you want to find a solution that is, of course, safe. Well, the photos you submitted are very helpful, and just to give you a little bit of my background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and hair loss treatment has been a very big part of my practice. In fact, I'm the founder of TrichoStem Hair Regeneration Centers, a non-surgical alternative to hair transplant that we have developed in our practice, a method we call hair regeneration that has been a very successful in helping people with minimal invasive approach. So I can certainly speak to you from a perspective of treating a lot of patients like yourself. So to understand that basically you're dealing with is most likely genetic pattern hair loss, or something called androgenetic alopecia. And the early onset is not unusual, and there's a general rule of decades where in your 20s, 20% of men have hair loss, 30s, 30%, etc. So understanding that you have a relatively aggressive genetic pattern where you have an early onset and it seems to be a relatively rapid progression. Now, in terms of medical therapy, you probably are already familiar with finasteride, which is a pill that you take daily, and Rogaine, which is a topical solution or foam. Now, I think that when you ask the question about safety, I think you've probably learned about the concerns people have about long-term sexual side effects from finasteride and any of the other relatively minor side effects that are associated with Rogaine. However, I think that from our experience, what we've developed in our practice is an alternative called hair regeneration, as I mentioned earlier. This is a method that was derived from the application of a wound healing material called Acellular matrix combined with PRP, or platelet-rich plasma. Briefly, platelet-rich plasma is derived from your blood. It's a concentration of the wound healing and growth factors necessary when you, for example, cut yourself. Now, these cells and factors actually help with wound healing, and initially this technology was being employed in our practice for the improvement of outcomes on hair transplant. What we wanted was improvement in the graft survival. We wanted the donor areas to heal better. What ultimately developed, of course, was this observation that thinning hairs actually became thicker. What was even further important for me was that when I looked at people who had just thinning hair and I tried just the treatment alone, it actually, in some cases, it was superior in the results when compared to hair transplant. The unfortunate reality with hair transplant is that if you have existing hair, when the openings are made or the graft sites are made, you can get a fair amount of loss of native hairs, we call, unfortunately referred to as collateral damage. Now, that putting aside, in our practice for patients as young as 18, we have had more than 99% success for men and women of all ages in seeing improvement with hair regeneration. This is a treatment that's an injection that is throughout the scalp, and it actually will stop the progression, will allow for regrowth of hairs that are not growing actively, and cause thinning hairs to become thicker. with more than 5 years of data and very good follow-up, we actually follow our patients every 3 months and take digital photos and microscopic photos and document their improvement. We've been very pleased with this success rate, and in comparison to drugs and surgery for people who have hair, this has been a great option. I think that it's important for you, since time is critical, to learn more about this option and look for someone who offers a procedure like this. I think that this is an opportunity where you won't, and without saying, discounting the option of medical therapies such as finasteride or Rogaine, but I think that hair regeneration really intercedes with hair loss in a way that is unique from pharmacologic options. And at the same time, in a remarkable way, this one-time treatment, or in some cases when we do this a second time between 12 and 18 months, we're able to sustain significant improvement for years. And that result is actually unparalleled. So learn more about this option, and once you're comfortable with the doctor, move forward with the treatment. I hope that was helpful. I wish you the best of luck, and thank you for your question.